present For the Record.
Welcome to For the Record. I'm Naomi. It's been a sobering week for anyone tracking international news, watching the images of Afghans in fear for their lives, trying to push their way into planes leaving Kabul after the Taliban's swift takeover of the country. Now, that international news is coming to Wisconsin's own doorstep. The Pentagon announced this week that Fort McCoy is one of 3 military installations authorized to receive up to 22,000 Afghan refugees. There is a lot we don't know, like how many are coming, when they'll arrive, or how long they'll stay. But I'm joined by Dawn Burney from the Jewish Social Services here in Madison, who can help us at least understand first how to help them a bit more. Dawn, thanks so much for joining me today.
Thank you for having me.
Dawn, I actually want to start with how little information there is right now. Tell me a little bit about how you found out they were coming.
We actually found out they were coming from the news. On Monday, we started getting calls about what was happening in Afghanistan, and obviously we knew about the horrors at the airport and that the last commercial flight had taken off. But we actually learned from one of the reporters that came to our office to do an interview that there were going to be people coming to Fort McCoy. And that was how we first learned about it. In actuality, we let HIAS know, and HIAS is the National Refugee Agency that we are an affiliate of. There are 9 national agencies doing this work, and there are 4 agencies in Wisconsin, and the one that we work with is HIAS.
So there's a lot of information going back and forth right now. So let's start with the basics. What are some ways that viewers can help Afghan refugees as they arrive?
Honestly, the biggest help that anyone can do right now is to make donations to refugee resettlement agencies. We typically get at least a couple of weeks to prepare for a new arrival. We expect that once people start coming to the United States, that there's going to be a very quick turnaround and need to get them moved to their permanent housing. And we can't find permanent housing in 2 or 3 days, so we will likely have to put people temporarily, at least for a few days, into hotels, and that's expensive. It's important that we have flexibility based on whatever needs families are coming with, because many of them are potentially coming with nothing. And while there are certain things that we pay for them automatically, there are other things that we have to fundraise to help pay for.
Now, what do we know about the legal status of these refugees? What kind of processing is going to be ahead for them as they arrive?
Typically, if you have SIV status, which stands for Special Immigrant Visa, it means that you worked for either the American government or an American government contractor, either in Afghanistan or Iraq, and you have more flexibility about coming to the United States. Most refugees need to go wherever they are assigned. SIVs are able to request where they want to move to. Most move to places where they already have friends or family. We have a fairly significant Afghan community in Madison because SIVs have been coming here. What we expect to be happening now is there's people who are in the process of getting SIV status. And many of those people are going to be put on planes and coming to the United States. So they haven't finished all their paperwork to officially become an SIV. So that's the processing that's going to be happening in Fort McCoy.
You touched on this a little bit about, as those Afghan refugees come in, they get more permanent housing. But what about permanent resettlement? Walk me through a little bit of the timeline of, that first few nights in a hotel. Then is that temporary permanent housing as you get them into something a little more permanent while they work on that resettlement?
Typically, we are able to find housing and move people into their permanent housing as soon as they arrive. But we need at least a couple of weeks to be able to pull that off. we're trying to do it more quickly. So what we would do is what we are doing now, because we have had some new arrivals recently, including from Afghanistan in the last month or so. We'll put them into the temporary housing. We immediately are looking for permanent housing. And part of our responsibility is to find the permanent housing and fully furnish the apartment, including household goods, including a stocked fridge and pantry, and a culturally appropriate meal. We are fortunate in Madison that we work very closely with Open Doors for Refugees, which is an all-volunteer organization that does all of the furniture collection for us, and they actually are the ones who do the staging of the apartments.
What you just described is very expensive, when it comes to getting those apartments, furnishing them, all of that. So you mentioned donations. Are there any other streams of funding that Jewish Social Services uses as far as just establishing these refugees?
So we actually get approximately $1,000, maybe $1,100 per person when they arrive. And we are supposed to use that specifically for the refugees. So we can use that money for things like the housing, the apartments, anything that they need when they first arrive. We know that housing is incredibly expensive in Madison, and we want to help give people a cushion. So the reason we do so much fundraising is we guarantee all the refugees we resettle security deposit and 4 months rent. But the $1,000 per person, because it's a one-time thing, doesn't cover that. So we need to make up the gap.
That's a massive gap in Madison. Let's back up a bit if we could. Bigger picture, can you give me an idea of refugees in southern Wisconsin from all over the globe over the last few years?
In Madison, we primarily have been focused on people from the Democratic Republic of Congo and Afghanistan, although we've also resettled from Burundi, from Pakistan, from Syria. And then up in Appleton, they also have a wide variety. Right now, I know that they're doing quite a bit with the Congolese, but they're also doing a number of other countries.
Is there anything I've missed that you'd like to add to this?
We are all really, really grateful for everyone's support. And the one thing that it's going to sound strange to ask, but please understand that refugee resettlement agencies in Wisconsin are small, and we are getting a little overwhelmed right now in a good way for people calling, wanting to help and wanting to volunteer. But particularly because these refugees haven't arrived yet, we may not even be able to get back to you to say, hey, we cannot use your help right now, but check again in a month or two.
Important context. Dawn, thank you so much for taking time to chat today and for your organization's work in the community.
Thank you so much for having me.
All right, just ahead, I'm joined by my investigative partner, Madeline O'Neill, with her latest back-to-school investigation. Welcome back to For the Record. Back to school will be very different for the second straight year. This year, far more students are back in their actual school buildings, but how are districts keeping them safe? COVID-19 policies vary district to district, and we found out districts can't require students to get the COVID-19 vaccine. But as Madeline O'Neill shows us, districts can track them, but not all of them are.
No question, the pandemic veered schools off course.
I feel like we've made some really good decisions, even though they're tough and not everybody agrees with them. It's been a good ride.
To make it through another year with COVID-19 as a backdrop, Portage Community School District Superintendent Josh Sween wants to bring safety to the forefront.
It is a personal choice, but I think as a school district, we need to encourage people to get vaccinated.
He says about 84% of his district staff members are vaccinated, and families will be asked to voluntarily report if their students got the shot during registration, which helps with contact tracing.
Last year, if you were a close contact, you may not even be sick, but you're out for 14 days. If you get the vaccine this year, you can stay as long as you don't have any symptoms or you don't get sick.
that tracks with the Wisconsin Department of Health Services COVID prevention guidance from this year, which directs schools to establish a process for collecting, maintaining, and using COVID-19 vaccination information because, quote, many recommended COVID-19 prevention strategies rely on having knowledge of the vaccination status of students, teachers, and staff, in addition to other layers of protection.
I'm going to be seeing their smiling eyes and their springing their step as they walk in.
Beloit Superintendent Dan Keyser says the Rock County Health Department is keeping track of student vaccinations.
That helps us kind of measure and gauge where our student vaccination rates are.
In the case of a close contact, Beloit school nurses can access the Wisconsin Immunization Registry for students to provide the right guidance.
The Delta variant is much more contagious and it spreads more rapidly. So
the state's Department of Public Instruction encourages school districts to, quote, seek parent/family permission to access student COVID vaccination status via the WIR.
We're an educational agency, and so we really want to see schools stay open, be successful.
News 3 Now sent a survey to the about 75 districts in our area. Of the 19 that responded, nearly half had no tracking plan in place or were still deciding at the time of the survey. Middleton, Cross Plains area, Stone area, and Madison Metropolitan School districts are among those that won't be tracking COVID-19 vaccinations.
For one, we don't have the ability to do so.
MMSD spokesperson Tim Lamont says there's no tracking system because they aren't mandating the vaccine among staff, and the state hasn't mandated student vaccinations.
We really are relying on our health services department to make all those determinations and contacts as far as tracking and quarantining.
He notes that all districts are different as they navigate the ever-changing landscape of this pandemic.
There's no easy answer.
In Portage, Sweden hopes to get back on track and stay there.
I do believe that vaccination is a big part of our push to get kids back in school and to keep the schools open and keep them here in person.
In Portage, Madeline O'Neill, News 3 Now.
Maddie joins me now with more on this story. So what we have is this situation here where the state is recommending one thing and we have a number of districts doing something completely different. Why is this tracking, first of all, so important?
Well, the state recommends it because it's important for a lot of these COVID mitigation strategies that they recommend in their guidance this year. So a big one is with contact tracing. If you have a student who has a close contact with someone who has a confirmed positive case, if you know that they're vaccinated, then they don't have to go through that quarantine period, meaning missing out on going to school, but also activities like sports. They won't have to miss those days of school if they're, not showing symptoms. So that's why tracking vaccine status is so important for schools.
Yeah, that makes a lot of sense. So then why is it that so many districts, especially large districts, are not tracking them?
And that's interesting. And, that's something we found out when we did the survey, that a lot of schools just don't have a system in place when the Department of Health Services recommends that you put a system in place similar to what you have for these routine vaccinations. So with MMSD, our biggest school district in our area, they basically said they aren't doing it because they aren't mandating vaccines for their staff, and obviously COVID-19 vaccines aren't mandated for students. So currently, they just don't have that system in place.
Yeah. What about regular COVID-19 testing? Is that something in your conversations you're hearing a lot of districts doing?
Well, that's interesting, too, because the state recommends if you don't have a system in place for tracking student and staff COVID-19 vaccinations, you should do some sort of regular screening testing for staff. And that is also something that, for instance, MMSD isn't doing, saying that they just don't have the equipment, the staffing resources in that sense to do that.
Now, you had an interesting follow-up to this story I want you to expand on a bit. Basically, a kind of this new concern that school officials, health officials are having when it comes to tracking vaccinations, having vaccinations. Talk a little bit about that.
So as far as these routine vaccinations go, things that protect students against these serious diseases like measles, mumps, polio, chickenpox, those actually dipped in 2020 as well, obviously because of the pandemic. Doctors were pretty busy, but then also some families were just a little concerned, during the fall and winter going into the office. So those dipped, and doctors really are trying to push, hey, your kids are likely behind on these routine vaccinations. It's very possible that an outbreak could occur. That's the setting in which it would. And so it's so important to get into your doctor's office, get back up to date on those routine vaccinations, and try to do so pretty quickly because those appointments fill up pretty fast before the start of school.
All right. Well, hey, thanks for joining me.